Hi, I'm Dr. Scott Kahan, Medical Director of the Strategies to Overcome and Prevent STOP Obesity Alliance. It's important to keep a number of considerations in mind when beginning a discussion about weight with your patients. Recognize that weight is about health, not appearance. Weight is a personal and often sensitive topic. As healthcare providers, we should tailor our interactions and words in ways that are productive, inclusive, and empowering, never stigmatizing. Our role is to educate patients and support our patients, never to blame or shame. Be aware of your own attitudes towards weight and obesity so that you can compassionately interact with patients on matters of weight. Patients with obesity should be treated just like any other clinical patient. This includes respect, attentiveness to the patient's desires and expectations, attention toward understanding the clinical presentation and etiologic factors, and offering unconditional problem-solving, treatment, and support. There's a few specifics to keep in mind. Start by asking permission. Body weight is as sensitive a topic as there is in many people's lives, particularly those who are most affected by obesity and severe obesity. Simply asking if it's okay to discuss a patient's weight is a useful strategy to disarm an otherwise tense topic. Second, work together. Traditional doctor-patient discussions about weight tend to be paternalistic and directive. The science of health behavior change shows that collaborative interactions are much more productive to help patients move from pre-contemplation to contemplation, from inaction to action, and from stuck to moving forward. Consider using motivational interviewing as a clinical conversational tool for productive interactions. Third, always consider the patient's situation. Health behavior decisions are heavily influenced by our environments and social norms. Learn about your patients' everyday lives, behavioral settings, resources, and social supports in order to better understand their barriers to behavior change and weight control, their opportunities for engagement, and ways that you can support them in their weight management attempts. Environmental factors, such as the availability of community resources and safe and affordable places to be active, strongly impact the choices patients make about their food intake and physical activity. For example, if a patient has minimal access to a grocery store with healthful options, or if they don't feel safe being outside, it can be difficult for them to follow diet and exercise recommendations. Fourth, don't do it all at once. Managing weight is a long-term engagement. Just starting the conversation and offering ongoing, supportive partnership is extremely valuable. Long-term results come from ongoing interaction, communication, problem-solving, and commitment, both on the part of the patient and the provider. Finally, don't try to do it all by yourself. While the provider-patient relationship can be invaluable for weight management success, there are many resources available to help. Consider using referrals as necessary, including community-based programs such as YMCA education classes, diabetes prevention program-based weight management programs, evidence-based commercial programs such as Weight Watchers, and clinical specialists such as registered dietitians, board-certified obesity medicine physicians, and bariatric surgeons. We created a website called Why Weight to give healthcare providers tips and resources to support your conversations with patients. You can find it at whyweightguide.org. I hope you'll find it helpful. Thanks for listening, and best of luck to you and your patients.